everyone and welcome back to the channel. Today we are going to talk about some of the most commonly asked cysts. In this video we will be doing some of the cysts which are commonly asked in your very important exams like your NEET PG, triple, ComTech, etc. So let's get started. The very first cyst that today we are going to do is nasopalatine duct cyst, as the name is suggesting, nasopalatine duct. Okay, the cyst which is most commonly in the area of nasopalatine duct. Okay, so this cyst is mainly in the area of incisive foramen. Okay, and it is seen in the midline between central incisors. So when you're gonna see the radiographs, you will be seeing a black area just above the central incisors, which is roughly of a heart shape. That's why it is also called as a heart-shaped radiolucency. Now, it is the most common non-odontogenic cyst. The cause of the cyst is not related to teeth. That's why it is a non-odontogenic cyst. And the cause is due to the entrapped epithelial cells during embryonic fusion of palatal bones. The embryonic light when the palatal bones are fusing, at that time when some of the epithelial cells got entrapped. Due to that entrapment, such cyst is developed. Let's jump to another cyst, that is globulomaxillary cyst. The globulomaxillary cyst, also called as controversial cyst. Why it is called as controversial cyst, we'll talk later. Okay. Now, globulomaxillary cyst is a cyst which is found within the bone. It is found within the bone, and it is a spear-shaped, inverted. It is spear-shaped, it is inverted, and it is seen in the junction of medial nasal process. Okay, so this cyst is basically a pear-shaped cyst which is inverted, and it is seen in the junction of medial nasal process, lateral nasal, and maxillary process. So, it is seen in the junction of three processes: medial nasal process, lateral nasal process, and maxillary process. Now, it is basically seen between lateral incisors and canine. As you can see in the diagram, if a X-ray is shown to you and you're gonna see a black area between the roots of lateral incisor and canine, it can be most commonly diagnosed as globulomaxillary cyst. Now, it is also called as a fissural cyst. It's a fissural cyst, and it is also called as maxilla cyst. This is the most common question which is being asked to us. That is maxilla cyst is also called as globulomaxillary cyst. Now, all the histological features of globulomaxillary cyst are seen as OKC, that is your odontogenic keratocyst. So, histological features you can revise from your odontogenic keratocyst. Okay, so the basic information is that spear-shaped, inverted, it is found within the bone, between medial nasal, lateral, and maxillary process, and between lateral incisors and canines. It is a fissural cyst, and it is called as maxilla cyst. Now let's come to another cyst that is called as nasoalveolar cyst. It's called as nasoalveolar cyst. Now, you can appreciate the diagram that I've made here. This diagram shows a swelling. Sorry. Okay, so this diagram shows a swelling in the maxilla, that is on the palatal surface, that is a hard palate beneath the upper lip. So, okay, so this diagram shows a swelling on the hard palate just beneath the upper lip, and swelling due to nasoalveolar cyst. Now, nasoalveolar cyst, also called as Clestat cysts, or it is also called as epithelial inclusion cyst, This is also the important question which is being asked. That is epithelial inclusion cyst, also called as nasoalveolar cyst. It is a soft tissue cyst. It is not found within the bone, as previously globulomaxillary cyst found within the bone, but it is found in the soft tissue, and there is no radiographic feature which is characteristic of it. So there is no acid radiographic characteristic feature, but you're gonna see a swelling in the mucobuccal folds and the floor of nose. The floor of the nose and the mucobuccal fold. You're gonna see a swelling, and there is erosion and distortion of inferior bottom of the nasal fossa. So, I'm sorry, today my thought is not that much good. Okay. Sorry for the inconvenience. Erosion and distortion of inferior bottom of nasal fossa. Do you know what nasal fossa is? Okay, so fossa is a part in the nose and it has border. The inferior border of that fossa, it gets distorted and there is erosion of that part. So due to this, there is a swelling in the mucobuccal fluid. I'm sure that you're gonna be doing this at what is mucobuccal fluid. You have studied about it inferior alveolar block that has a landmarks for inferior alveolar block. So that mucobuccal fold and the floor of the nose, they are swelled up, and there's no radiographic feature in this. So that nasoalveolar cyst, even though in the name it is written as alveolar, like bone involvement, but actually it's a soft tissue cyst. Okay, so it is also called as clefts cyst or epithelial inclusion cyst. Now let's move to another topic, that is mandibulofacial distortion. Now this is most commonly asked in exam, that what is mandibulofacial distortion? It is also called as Treacher cell syndrome. You must have heard of this name, Treacher cell syndrome. You must have heard of Francis thing. Now, what are the features? Actually, this diagram is not good, so you're not going to be knowing anything about it, but you should know about the features. That's bird-like face, and there is hypoplasia of malar bones. Two important things, that is bird-like face and hypoplasia of malar bones, are the characteristic features of mandibulofacial dystosis. So, in the mandibulofacial dystosis, the face becomes bird-like, and there is hypoplasia of malar bones. It is also called as Treacher cell syndrome. How are you going to learn it? Treacher, teacher. So teacher. So basically, what happens when student doesn't study? Teacher used to slap. So basically, it's used to slap, so it's gonna hurt your ramus, okay, or the body of the mandible. So that from there you can learn that yes, mandibulofacial distortions will be happening. So yeah, mandibulofacial distortions is basically Treacher syndrome. I can just tell. Now let's come to another topic, that is your congenital lipids. Sometimes it is asked that what are lipids, okay, and when they are congenital, so what are they called? And what are the characteristic features? So characteristic features is van der Waals syndrome. There is a syndrome named van der Waals syndrome. Van der Waals syndrome. So in van der Waals syndrome, there are some pits in the lips, which is called as congenital lip pits. Now, this syndrome is associated with cleft lip and palate and congenital lipids. Okay, so this syndrome, that is van der Waals syndrome, it is associated with cleft lip and palate. So people who are having cleft lip and cleft palate must be having a syndrome, that is van der Waals syndrome, and in this syndrome, people are having congenital lip pits. Pits का मतलब होता है खड्डा, तो ऐसे लिप्स के ऊपर कुछ खड्डे खड्डे से दिखाई देंगे, तो कॉमनली उनमें दिखाई देता है जो क्लेफ्ट लिप और क्लेफ्ट पैलेट होता है. नाउ लेट्स टॉक अबाउट डबल लिप. कभी कभी क्या होता है कि जो हमारा अपर लिप होता है उसके नीचे जो हमारा पैलेट होता है उसमें कुछ इस तरह से स्वेलिंग आती है कि हमें दूर से देखने में ऐसा लगता है कि पर्सन इज हैविंग डबल लिप्स. So it is also called as, it's a part of Asher syndrome. एश्योर सिंड्रोम जो होता है उसमें डबल लिप हो जाता है और एश्योर सिंड्रोम में क्या क्या होता है बेल्फेनोचुलोसिस and it is associated with non-toxic thyroid enlargement. Okay. When people are having thyroid enlargement, which is not toxic, there are a number of types of thyroid enlargement, toxic, non-toxic. So when there is non-toxic type, then we have a associated thing that is bulgaric that is dropping of upper eyelid. So your upper eyelid drops down. That is bulgaric and this is basically seen in syndrome, Asher syndrome. Now, along with this in the Asher syndrome, we are going to see double lip also. So there are three things in the Asher syndrome. Bulgaric that is dropping of the upper eyelid. There is a non-toxic thyroid enlargement, and there is double lip. So these are some of the important cysts and some of the important topics that you really want to see in your question papers. So I hope this video will be helpful to you. And due to a bad thought, yes, the videos were too good, but yeah, I hope this will help you. Okay, thank you.